I would like to open this video by stating that postpartum depression is never a woman's fault, as she truly cannot control her hormones. However, if you ever feel like hurting yourself or hurting your baby, make sure you call your local emergency services or reach out to a family member, a trusted friend, somebody who can get you the help that you need as quickly as possible. Hello moms and dads, and welcome back to Nurse Onyi Teaches. My name is Onyi, and as you can tell by the title, today I am going to be talking about postpartum depression. Now, postpartum depression affects upwards of 1 in 4 women, making it a topic that needs to be discussed at length. Unfortunately, it does not get the attention that it needs because more and more moms continue to deal with it. So what I'm going to do in today's video is talk about what it is, who is at risk for it, some of the common signs and symptoms that a woman may deal with, and treatment modalities, including some things that a mom can do to help deal with the symptoms on her own. So what exactly is postpartum depression? Well, postpartum depression, simply put, is depression that a woman deals with after she has given birth to her baby. It is very important to make a distinction between postpartum depression and the baby blues. With the baby blues, upwards of 80% of all moms deal with this, and it happens because after a woman gives birth, her hormones have to re-regulate themselves back to a level of normal functioning. While this is happening, moms may deal with some degree of sadness, irritability, inability to sleep. She may deal with tearfulness, where she just cries for reasons that she may not know, and she may be very sensitive to things that normally would not bother her. However, if a mom gets the right amount of rest and eats a normal, healthy, balanced diet, this can help to relieve some of the symptoms that accompany the baby blues. With postpartum depression, however, even with trying to eat right and trying to get the right amount of rest, the feelings of depression still persist. It is important also to state that there is early onset postpartum depression, which generally occurs in the first couple of months after a woman gives birth. And then there is late onset postpartum depression, which can start upwards of 6 months to a year after a woman gives birth. So who is at risk for postpartum depression? Well, there are some factors that may increase the likelihood that a woman would deal with postpartum depression, and that includes any personal past history of depression or any family history of depression. If the mom had a difficult pregnancy or a very difficult labor and delivery experience, if her expectations after giving birth do not line up with what she thought would be there, or if she has a baby with health conditions that she was not properly prepared for, a baby that's having difficulties breastfeeding, or she just does not have any support, or her support is lacking to some degree, any kind of marital issues, or even just the fact that a woman is a single mom can predispose her to postpartum depression. So what are some of the signs and symptoms that accompany postpartum depression? It's very important to state here that this is not an exhaustive list of all the signs and symptoms. These are just some of the more common ones that women deal with, and they include anxiety that exceeds that 2-week period where the baby blues fall in. A woman may feel sad, she may feel angry. Some women feel guilty. It's very common for women to feel overwhelmed. Frequently, moms would doubt themselves. They don't want to participate in any activities that they normally would consider fun. You know, sometimes they sit home and they just cry excessively. They worry with really no reason to worry. And all of this adds up to the lack of sleep, or when they do sleep, it's a very poor amount of sleep. It can also affect the mom in that she has no interest to eat, or if she chooses to eat, she eats what is considered empty calories or does not eat enough of the right foods to properly support her healing and recuperation. Now, if a woman deals with any of these signs and symptoms, it is very important for her to seek help early. The earlier you seek help, the sooner you can get the right attention so that these symptoms can be properly managed. If these symptoms are not adequately addressed, they can negatively impact how you bond with your baby. They can lead to social, spiritual, personal dysfunction, and even more severe, it can lead to a condition known as postpartum psychosis, where a woman begins to have delusions, or she can even hallucinate and hear voices that tell her to harm herself or her baby or even others. So make sure that you are seeking help and that you do so early in the process. If you ever feel like hurting yourself or hurting your baby, make sure you call your local emergency services or reach out to a family member, a trusted friend, somebody who can get you the help that you need as quickly as possible. Now, postpartum depression can and has been successfully treated in the past. It usually involves a combination of medication and therapy sessions. It is also important for a mom to involve those who can help her through the journey. Involve your support person. This includes your partner, your parents, your neighbors, individuals from your church or local support groups. If you find yourself in a situation where you're a single parent and do not have anybody in your immediate circle to help you, you can join some online groups so that you can learn what some moms have done to help them manage the symptoms. However, if you do have people in your immediate circle or you are that support person watching this video, be sensitive to the needs of these moms who have just given birth. If they need help with meal prepping and delivery, make sure you step up to assist them to that capacity. If she needs to pass the baby off to somebody so that she can rest, while these things cannot effectively treat postpartum depression, they certainly help with the management of the symptoms. So make sure that your village is around you, being very supportive, being hands-on, so that you can get yourself together and begin to establish a schedule that works well for you and your baby and help you manage postpartum depression. Now, if you have learned anything from the content of this video or you know somebody who can benefit from it, be sure to share this with them. Do not forget to hit the subscribe button and turn on the notification bell so that you are made aware of every time I upload a video. What I am hoping to do here is to build a community of learners who are well informed and able to advocate for their own self-care. So make sure you join me. And until the next time, be blessed.